Essential workers who can't work remotely are now eligible to take part in a research study at the UW School of Medicine.
The SHIELD study is investigating whether some commonly used nasal and mouth rinses can help reduce the spread of COVID-19.
Dr. Nassia Safdar is an infectious disease physician at UW Health. She joins us now. Welcome back to Live at 4.
Hi there, good to see you.
Good to see you.
So tell us about this study. What's happening?
So what the study will basically test is whether application of two antiseptics, one's called povidone iodine, it goes in the nose, just like painting the inner surface of the nose, and the other is a mouth rinse called chlorhexidine, which is commonly used in dentists' offices. And the idea is to test that for people that use these products for 3 weeks at a time, do they have a lesser chance of acquiring SARS-CoV-2 infection, as shown by nasal swabs that will be collected throughout the study.
Now, who are the essential workers that are eligible for this study?
I think anyone where they cannot perform their job duties remotely, and there are certain tasks and certain job roles where it simply can't be done. So, for instance, public transportation, police, fire, paramedics, grocery store workers, restaurant workers. These are all people that are at higher risk of getting exposed just by virtue of the work that they do.
So what's the science behind this? The chemicals interact or break down the virus?
Well, we know that the virus enters through the nose and mouth. So if it's possible to put material in the nose and mouth that will inhibit the growth of the virus and prevent it from going further into the body and causing the symptoms, that would be a valuable addition to prevention of this infection. So based on lab data, it looks like these antiseptics have the potential to do that. What we don't know is in the real world setting where people are applying it in the nose and mouth, does it actually work for reducing SARS-CoV-2? And that's the reason why we're doing the study.
Are the antiseptics available in the general public, over the counter, for example, or are these regimens that are used in a hospital setting?
Well, chlorhexidine is available over the counter and in dentists' offices, for instance. They're commonly given to people to rinse after they've had dental procedures because they're antiseptics and they prevent infections. Most of the literature that's available on both the povidone iodine and the chlorhexidine has been from the hospital setting because they're used to prevent surgical site infections in patients who are undergoing surgical procedures, and they're used to prevent pneumonia in people who have a breathing tube. So there's a lot of experience with these in the hospital setting, probably a bit less so in the community.
So how can essential workers get involved in this study?
Well, it's very simple. The study is entirely remote. No in-person visits is required. You mail in your specimens and we mail the study product. There's a website that if you sign up to and provide your contact information, all the consenting and all of the description of the study procedures can all be done remotely. We felt that was important so that the more people that wanted to participate in this study, the easier we wanted to make it for them.
How big of a game changer do you think it'll be if the study reveals that it does play a significant role in preventing COVID-19?
I think if it shows that it works, it will add to our other options for reducing this infection. Vaccine, of course, is the key thing for preventing SARS-CoV-2, and we encourage everyone who's eligible to take it. But there are people who either don't want to take the vaccine or those who cannot take the vaccine because of allergic reactions or other reasons. And so especially for that group, I think, if this works, that would be a really important way to try and change the trajectory of this pandemic.
All right. And don't limit to the number of participants?
At this point, no. We're willing to take whoever signs up. We expect to enroll enough that we can answer the question definitively. Does this work, and is this a useful thing to try and prevent infection? So we still have a ways to go.
All right. Doctor, thanks for being with us today. Interesting study.
Yes, great to see you today. Thanks for your time.